up the waiting room.
Thank you.
All right.
And we're being live streamed, so everyone knows.
Okay, great. 1 second. Everyone. All right. Hello, everyone. Thank you for joining us today. It's now just a little after 2:30 p.m. Eastern, so we'll go ahead and get started. Welcome and thank you for coming to this month's COVID Information Commons Research webinar. My name is Laura Close. I'm the Operations and Communications Manager for the Northeast Big Data Innovation Hub here at Columbia University, and I'm also a member of the COVID Information Commons project team. The COVID Information Commons, or KIC, is a COVID-19 research collaboration platform brought to you by the Big Data Innovation Hubs and funded by the National Science Foundation. Every month, the KIC brings together scholars from all over the country to share their research finding in the form of lightning talks. Each scholar will engage the community directly, answering your questions about their work during a Q&A session at the end of the presentations. I should also note that we at the KIC are committed to providing a supportive and welcoming environment to everyone who works, studies, or interacts with the Hub community at public events. So we encourage you to review our code of conduct for online programs on the Hub website, which includes information about reporting and accessibility features. And I will drop a link to those resources in the chat for you shortly. But before I hand you over to today's fantastic group of speakers, I want to first mention the other members of the Hub team that we have on the call today. We have with us, importantly, Kaylin Coe, who's a volunteer with the Hub. She will be helping me do a little bit of work on the back end, and we're so grateful that she's here today, along with the Executive Director of the Hub, Florence Hudson, and Florence will give us a bit of background information on the KIC and introduce you to some new features that we've implemented just this month.
Excellent. Thank you, Lauren. And I really want to thank Lauren for doing an incredible job of setting up these COVID Information Common webinars and for reaching out to the PIs, researchers, and students and volunteers who are with us today. So thank you all for joining us. So the COVID Information Commons started in 2020 when the National Science Foundation contacted the Northeast Big Data Hub here at Columbia University and asked us if we could create a single portal that would help people easily find NSF-funded COVID-related research. This was in March of 2020 when everything closed down and everything started happening everywhere. We got the award working with the other big data hubs in May of 2020 and then launched the initial MVP, or minimal viable product, for the COVID Information Commons in July of 2020. Since then, we've had over 20 of these webinars because initially we just thought it was going to be a portal. But what happened is we had over 40 researchers who said they would like to present their research to enable collaboration with other researchers. So since then, we just keep doing these until we run out of researchers that want to talk about their research. And I don't know if that's going to happen for a while. So we're delighted that we have such a great community, and we're very, very thankful to NSF for the original award in 2020. And then last year, we received the COVID Information Commons Extension Award in 2021. And so thank you, Lauren. With that award, it's really to broaden the impact of what we do. And we have a number of things we promised with that. One of the things was, when we first started this COVID Information Commons and it's NSF funded, we're talking about a disease. So I was saying, we really have to have NIH in the loop. So we invite NIH researchers every month to present and participate with us. And now what we've done is we've actually launched on the next slide, a larger extended COVID Information Commons. So initially when NSF contacted us, and I went into the simple search, there were 32 COVID-related rapid awards, in 2020. Now there are many thousands. And so now what we've done is we have a very up-to-date pool of NSF-funded COVID-related awards. They're currently 3,530 in the KIC. And also we've added NIH awards now using their API. And so 4,278 NIH awards at this point. We'll update this every month. And what we've done is we've expanded the view of the types of keywords we look for in the poll when we do the API search at NSF and NIH. to include some of the terms that we didn't use when COVID first started, like mRNA or long COVID or things like that that have come to be. And what's interesting is we've also expanded it so it wasn't just like rapid awards and awards starting in 2020, but we're allowing it to be longitudinal going backward too. So as an example, when you look at mRNA has been around for, decades. So if you're doing research around mRNA for COVID, it might be interesting to see what other research was done in the past and how it relates to the future. So we have a more longitudinal view. We have NSF and NIH awards. We've updated it so you can look by funder at the top, which would be NSF or NIH at this point. We're looking at adding other awards databases. It could be CDC, the Centers for Disease Control in the US. It could be AHRQ, which is another hospital and human services agency. And if you know of other vetted, funded COVID-related awards, let us know. But that's where we are now. You can browse the database. You can actually also volunteer to take a test drive through the new website. We launched the MVP for this extension on June 30th, but we would like some user feedback on the best way to enhance it as if you like. Thank you, Lauren. So for the next slide, you'll see, and we plan more enhancements for the KIC from this extension award we got in 2021. We had an inaugural student paper challenge in 2021, and we just announced the 2022 student paper challenge. This is open to all students from around the planet in higher education institutions, community college, undergraduate colleges, universities, graduate students, and recent graduates are in between things if they'd like. So you can learn more about that, and you'll be seeing that from Lauren. We're going to have our first annual KIC community workshop at the end of this year. We're looking at November right now, 2 half days. So it's not too zoomy, overwhelming. And what we're doing now is taking input we got from a community survey we did last month. Thank you for those who responded to it, to identify the key areas of panels and collaborative discussions we'd like to have. This is meant to be as workshopy as it can be in a virtual setting. So we're looking to have people that are interested in certain topics we're identifying to pile on and say, I want to be on that panel, or let's make this a 20-person discussion. I'm okay with that, because what we want to do is enable researcher collaboration. We're going to be creating KIC research working groups based on the topics that are of most interest across the community. We have PI profiles in the database right now from the NSF awards we first had in there. We've extended the PI survey to include NIH, but with almost 8,000 awards, we want to create an automated KIC PI survey ingestion tool. As you can imagine, we had our students and staff putting all the data in by hand from the PIs. So the PIs can put in their ORCID ID, links to their data sets. If you do a webinar, like a lightning talk webinar like today, we put the link to that in there, and collaboration opportunities, how you would like to engage with people. And then we're also going to be adding a search for co-PIs. It's just PIs right now. We have to make sure we know how to organize everything for the co-PI search as well. And then what we want to do is enable development and delivery of new metadata and data search and discovery mechanisms. So now when you go into the KIC, you put in a keyword, it goes through the KIC corpus, which is the NSF and NIH award information from those websites. You can link through to go to any information the PIs provided regarding their research. We also have another element on the KIC database that actually has groups and guides and data sets from around the world. We don't currently do a search across all of that. We just go against the KIC corpus. So what we're going to look at is how we can leverage more of that information more broadly when you do a keyword search, not just to find the NSF and NIH related research, but also to take advantage of these other sources that we vet. And then we'll be doing ongoing metadata curation. And we also have a volunteer program. Kaylin is one of our volunteers with us today. We're so excited. And so if you know any students that would like to volunteer with the Hub, they could help, co-moderate Q&A. They can write blog posts. We have other types of events that they can help with. And so that's really what we're up to. And we're just delighted that the community is so vibrant and collaborative, and that NSF continues to enable support for this. So those are our plans for the KIC. That's what we have now and where we're going. Thank you, Lauren.
Thank you, Florence. And as we noted just a moment ago, I want to mention a bit here to the group about the Kick Student Paper Challenge. This is a program that we launched just earlier this week. And in the Student Paper Challenge, we're asking students to leverage the numerous resources available through the Kick website that Florence had mentioned to develop their own research paper on COVID-19. And as we mentioned, the challenge is open to undergraduate and graduate students at public and private universities, colleges, community colleges, all of the above. Recent graduates are also welcome to participate. We're inviting STEM and healthcare researchers, professors, and professionals generally to participate in this challenge as mentors and judges as well. The winning papers will be published on the Kick site and could be featured in a future Kick webinar like this one, possibly in the Kick annual community workshop, which, as Florence noted, will happen this fall. The webpage for this challenge directs students to a variety of COVID-19 related research topics and resources, including the awards database we were discussing, recordings of other webinars like this one, external data sets, groups, guides, anything that you might need while you're crafting your first paper like this for COVID-19 research. And the idea is that papers will demonstrate a thorough understanding of objectives and methods for COVID-19 research, make insights and recommendations that contribute to greater societal goals. So this is a great challenge for students. We're currently accepting proposals for student participation, mentors and judges participation. We'll be sending out email updates to our community on this project in the coming weeks. So please do visit our website or sign up for our newsletter to get the most up-to-date information about our programs. But without further ado, I do want to get to today's presentations and our speakers' work. So this afternoon, we'll be hearing from three fantastic researchers coming to us from across the US. And I'd like to kick us off by introducing you to our very first speakers on the docket today, Alysha Ramirez Hall and Michael Medina. They will be sharing their research on mental health and the pandemic. So I will stop sharing, and I believe Michael, please feel free to share your screen and kick us off with your talk today.
All right, thank you so much. I'm just going to adjust so you see the proper portion of my screen. Does that look good to everyone?
Looks good, thank you.
Wonderful, and thank you. And thank all of you for coming. And I appreciate your time. Again, my name is Dr. Michael Medina, and I'm so excited today to discuss research conducted by myself and a team of my colleagues across the country on changes that college students have faced during the COVID-19 pandemic across different social contexts. Now, among educators especially, one of the most obvious and talked about such changes to college students' lives from pre to mid-pandemic is the transition of schooling from an in-person format to a virtual or more of a hybrid format. This was and continues to be a major social context shift that has touched the lives of, at least to some degree, nearly every single student and educator in the country. Much has been said, and lots of research has been done to capture the extent to which there were hardships and detriments associated with this historic shift. But that being said, there were accounts of students and teachers who preferred elements of remote learning and appreciated the opportunities for peace and differently paced schooling that that kind of remote instruction provided. So with these and other kinds of COVID-related shifts in mind, our team sought to answer two questions. One is, what are some of the other social contexts in which college students' lives shifted unexpectedly prior to and during the COVID-19 pandemic? And how did such shifts impact students' lives either positively or negatively, currently and in the long term? We drew data from a very large and ethnically diverse sample of STEM college students. Now, it wasn't our intention to draw data about COVID-19 because we started surveying them well before the pandemic began. Instead, we were looking for a diverse, nationally representative sample of college students to gather information about their social, emotional, and personal and academic experiences during the college years. However, after the pandemic began, we saw an opportunity. We reached out to them again about a multitude of changes and experiences they might be facing during COVID-19. Specifically, we saw a chance to compare how they were before the pandemic to how they were handling life and its unexpected changes during the pandemic. We have a lot of data on this and we're really excited to answer your questions about college students' experiences before and during the pandemic. But right now, we're going to be talking about 3 of the social contexts that college students were able to illuminate for us during that time. Specifically, we're going to discuss some of the changes to their social support systems mid-pandemic, the content they were consuming from the media during that time, and their academic experiences and preferences. Regarding their social supports, one of the starkest contrasts for students during the pandemic was the shift to living at home. Prior to the pandemic, students were reporting living at home less than 10% of the time. It's a very normative time for young people to be leaving the nest and living with roommates or romantic partners or on their own. Well, that number expectedly skyrocketed during the pandemic to nearly 50%, nearly half of college students that we surveyed either were living at home or moved back to home during the pandemic. Now, with the college years being a pivotal developmental period for the development of interpersonal relationships and personal autonomy, this change has the potential for really wide-reaching implications for this whole cohort of students' social development. And indeed, in our findings, we found that living at home was something of a double-edged sword for students. They were receiving positive messages during that time about their culture, their ethnicity, and their race, likely because they were seeing examples of other cultural members among their family at home. But at the same time, they were experiencing a lot more academic and social pressure, specifically experiencing feelings of stereotype threat and considering racial barriers to a greater extent than they would if they were living elsewhere in terms of how well they think they would do in their future careers. I think many of us can relate to the idea of feeling pressure from our family in relation to our academic and professional success. Now imagine you're living with your family throughout the pandemic during college, and you can imagine, I think, what some of these students were going through. Of course, families aren't students' only source of socialization. When we ask students about their media consumption and how they saw their ethnicity and their race portrayed on the news and social media every day, well, before the pandemic, college students were reporting mostly neutral ratings. They were seeing positive and negative depictions of their cultural background. But beginning in early 2020, that all changed. And the number of days that students reported seeing negative portrayals of their race significantly increased. Now, this was particularly true for 2 groups. One were the Asian and Asian American students, who were likely reporting this because of ties that were being linked between the COVID-19 pandemic and Asia and Asian American culture, and also white students, which we believe were reporting higher rates of negative racial depictions because comorbid with the pandemic were a number of racialized incidents of police violence throughout the country. This is an example of the fact that while COVID-19 was all-encompassing and overwhelming in its impact on students' lives, I don't think any of us would be shocked to remember that 2020 was full of a number of other negative and highly detrimental events that we believe would have long-term impacts on students' social emotional well-being. Now, of course, as educators, we were interested in how these changes coexisted with students' experiences in schools. During the pandemic, students reported, unfortunately, feeling a significant lack of teacher support, even lower than pre-pandemic levels, very likely due to that shift I mentioned from in-person schooling to virtual or hybrid formats. Now, that said, students had no shortage of peer support during this time, which maintained very high levels across both time points, prior to and mid-pandemic. Lastly, students of color, as was the case prior to the pandemic and is unfortunately historically the case, reported feeling underserved by their academic institutions, even mid-pandemic. They were faring off worse than white students at every time point, reporting lower levels of feelings like they belonged in school and higher levels of feeling like their race and others' depiction of their ethnic racial group would hold them back from professional and academic success. On balance, these and a number of other findings that we have painted for us a fairly vivid picture of the changes that college students have been and continue to experience over the course of the COVID-19 pandemic. Specifically, as educators and researchers, we may be inclined to focus our attention primarily on that shift from in-person to virtual back to in-person schooling. But what our findings suggest is that students are experiencing simultaneously a number of other changes across various social contexts, all of which need to be considered when working to support students' continued social and social emotional success. Going forward, our team is digging a little deeper into each of these contexts that I discussed with you and how they might have lasting impact on college students. So for example, what are some of the long-term developmental differences we may see based on where students chose or were forced to live during the pandemic? How did that negative media consumption spike shape students' identity beliefs in the long term? And how might peer support and the opportunity to have contact with diverse peers support currently underserviced students of color? We hope that these and other findings serve for a more smooth transition for college students, and we look forward to your questions about that. Thank you so much.
Thank you so much, Michael and Alysha. I'm sure our audience will have lots of questions for you about this presentation. So as a reminder to the group broadly, I'll note that we'll be hosting obviously a Q&A session at the end of today's webinar. We'll go through each of our speakers. And in the interim, if you'd like to submit any questions to our presenters, absolutely please do so in the chat. So I would like to now introduce our second speaker, Josh Hartshorne of Boston College. Today, Josh will present his research on children's development relating to screen usage during the pandemic, which is very interesting. So Joshua, please begin your presentation.
Yeah, I'm just, there we go, screen share. Oh, you know what, I should make sure I have the sound turned on.
We can hear you just fine.
Yep, great. Oh no, I meant the sound for the presentation. Okay, are you seeing the right screen?
Yes.
Okay, great. Thanks very much for having me. So everything I'm going to talk about and more are in these two manuscripts. I think this is going to be available on YouTube, so you'll be able to look those up later. So a number of well-known predictors of poor child development outcomes, such as watching a lot of TV or playing video games, childhood obesity, not being talked to very much. So there's a correlation, school success in terms of how much your parents talked to you when you were little. And a lot of public policy has been very inspired by these correlations and involve trying to intervene on parents to get the parents to change essentially their parenting practices. So, for instance, you see guides on how to control screen time or get your children exercising more, or in this viral clip from the last presidential cycle.
We have to make sure that every single child does in fact have 3, 4, and 5-year-olds go to school, not daycare, school. We bring social workers into homes and parents to help them deal with how to raise their children. It's not that they don't want to help. They don't know quite what to do. Play the radio, make sure the television, make sure you have the record player on at night, the phone, make sure the kids hear words.
So Joe Biden got a lot of flack for suggesting that parents should be playing their record players or possibly phonographs. But what was interesting was, to me, was how much there wasn't pushback on a really deep assumption here, which is that these are basically cultural problems with cultural solutions. As opposed to, there's another hypothesis that's been floating around for a while, but has made much less of an impact on public policy, is these are actually resource problems with resource solutions. So I was first, so a particularly nice, exposition is in this 2005 Margaret Talbot article in the New Yorker that was about Providence Speaks, or Providence Talks, I believe, which actually was a program in which they were sending social workers into low SES households to teach the parents to talk to their kids more. Anyway, a quote that I want to point out here is Richard Weisbord, a senior lecturer at the Harvard Graduate School of Education, helped establish a campaign in Boston that urged parents to talk to their kids, and he organized focus groups with low-income parents. You had some people working 3 jobs or dealing with the steady drizzle of helplessness and hopelessness, he recalled. That makes it hard to have vibrant conversations with a baby. They'd say, look, when I get home, I have to clean and cook and do the laundry. They're exhausted. They'd say, sometimes we have to put our kids in front of the TV. Weisbord said of interventions like Providence Talks, maybe we had the model wrong. Maybe what we need to do is come in and bring dinner and help with the laundry and free up a parent to engage in more play with their child. So again, to summarize this, hypothesis 1 is that parenting practices, if we think about screen time, lead to more screen time, and more screen time leads to obesity, nearsightedness, behavioral disorders, and so on. But it's also possible that screen time is really a symptom. So low familial resources lead to more screen time, and also obesity, nearsightedness, behavioral disorders, etc. And so intervening on screen time itself is not actually going to do anything. And obviously to test this, you would need to do a manipulation study. Now that's very hard to do. These are hard variables to manipulate. One of the outcomes actually of Providence Talks was they just weren't able to get parents to talk to their kids more, which is interesting in its own right. But COVID manipulated the family resources for us, right? So it took a whole bunch of people, and not entirely irrespective of SES and race, but still more cleanly than usual, affected people sort of across the board in terms of what sort of family resources they had. Particularly through school and daycare closures, loss of social support, and networks and babysitters, things like that. And for some folks, increased work at home. So here's a schematic of my own household. My daughter turned 2 just before the pandemic. She wasn't really a TV watcher at the time. And then the daycare closed, and suddenly she was watching, Frozen like 3 or 4 times a day. And then my mother-in-law came to stay with us for a few months, and we were back to not watching any TV. Then she had to go home, and we were back to watching lots of TV. And then my mother came to stay with us, and the screen time went back down again. Then she left, but then daycare started again. And we were back down to not a whole lot of TV. Now, this is what we call an N of 1 experiment. So we wanted to see how this generalized. And fortunately, there were a lot of data sets we were able to get a hold of that had relevant data. So we used data from the Kaiser Health Tracking Polls, AP NORC, the COVID Impact Survey, Understanding America, our own survey that we're running, and also Real Good streaming data. So Real Good is a streaming aggregator and search service. So they had, real-time, roughly geolocated data on how much people were watching child-oriented television and movies and whatnot. So this is, from our Real Good data, so the actual ground truth streaming data, and you can see all the schools closed within about 1 week. Daycares were a bit more variable, and there's just not good data on that, but daycares were mostly around that time period. And you can see a real spike in increase, like a big increase in screen time immediately afterwards. But of course, lots of other things were going on at the same time. You might think, well, maybe people were watching more TV because they were sick with COVID. And that it actually didn't track COVID rates all that particularly well. In particular, if you look at these numbers, so we see screen time, rising rapidly in March. And in March, as a first approximation, nobody in America had COVID, right? It was quite rare and located in just a few places. There was actually no time, so you can see here on the left, sort of the increase in streaming by, like March 16th. There's quite a lot all around the country, but only a few places in the US with some COVID. And at no point in our time period that we're looking at was there a correlation based of like state COVID rates and state like screen time increases. So also, people are spending more time at home. Obviously, so this is based on Google mobility data. It's more closely time locked to those closures when it starts, right? Of course, we knew that schools closed right when all the workplaces, a lot of workplaces closed. But then you see it sort of decouple after that. We also looked at parental mental health, and again, there was not a tight relationship. I mean, we know that parent mental health got worse after the schools closed, but again, it was not tightly locked. And in fact, we were able to, in some of these surveys, find that screen time increased greater for parents who lost childcare relative to those who didn't. And in fact, screen time probably increased in proportion to the extra hours of childcare that parents were reporting. We saw this across a number of data sets. You might think, well, what about on the other side when school reopened? Well, here I have increase in screen time by schooling policy. And you can see the kids who are online were getting the most recreational screen time. This is not counting school screen time. And the kids who are in-person schooling had the least increase in recreational screen time. And we saw that across a number of data sets. We also actually instantly looked at parental mental health because there was this report that parent mental health was worse. So you can see this in the Kaiser data, for instance. So the red and green are reporting more impact of just the pandemic on mental health by parents. So this is for parents who reported having lost childcare. You can see much smaller effect for parents who do not report, who report not losing childcare. And in fact, they look identical to non-parents. So the parent mental health effect was really specific to losing childcare. And we can see this in the Understanding America data. Here again, we have, parent mental health. So up here is bad. And mental health was best for the parents whose kids were in-person schooling, and worse for those who are online, hybrid, somewhere in between. Census household pulse data actually allows us to look at number of days of hybrid schooling that have a live teacher. So we don't know if this is in person or not, but just how many days of teacher they had. The more of that, the better the parents' mental health. So in conclusion, screen time variability can be driven by childcare resources. Screen time and parental stress can look at it as with screen time in particular as an adaptive response, right? So it's something that is actually helping parents cope, and trying to take it away from overburdened parents may actually just make the problem worse. This also suggests that cultural interventions may have a limited effect. It wasn't that sometime in March every parent suddenly forgot screen time was bad, right? It had presumably parents' beliefs about parenting didn't change. Their ability to act on them changed. So some caveats, of course, COVID times are not normal, right? So this may or may not generalize to all the rest of the time. And also screen time and stress may have their own negative impacts. That may be something that we do want to treat, even if we don't believe that treating them will actually solve the real problem, right? And that gets us back to, again, maybe we just had the model wrong. Maybe what we need to do is come in, bring dinner, help with laundry, free up a parent to engage in more play with their child. All right, thank you.
Very interesting. Thank you for sharing your research with us, Josh. Given the insights that we've heard from the first two sets of speakers today, I'm sure we're going to have a very active and interesting Q&A session But before we get to that, I want to turn the webinar over to our final speaker today. This is Michelle Korzanowski, who's at the Research Triangle Institute. She'll be discussing her work on the scope and functionality of the PhenX Toolkit. So Michelle, please feel free to share your screen.
All right. Okay, can you see it on my screen?
Yes, it's great.
Okay. Hi, everyone. So I'm Michelle Korzanowski. I'm from RTI International, and today I will be talking about the PhenX Toolkit COVID-19 project. So I will be talking about three components of the project: the COVID-19 protocol library, the COVID-19 variable compare tool, and the COVID-19 research collection. But before I get into those, I just want to provide some background. So what PhenX stands for stands for Consensus Measures for Phenotypes and Exposures. So this project, the entire project, has been funded by NHGRI since 2007. It was really driven by the scientific community who contributed and recommended measures that can be used with confidence and cover a variety of research areas. We promote this idea because study findings always require validation, where you would like to compare the studies and make sure that you are essentially getting the same results based on what you're asking. And of course, related to that, if you have a bigger sample size, you would have more statistical power and more validation of the results. And the idea behind PhenX is in support of the National Institutes of Health FAIR principles, which stand for findable, accessible, interoperable, and reusable. So what PhenX is, it is a catalog of recommended measurement protocols, so basically survey instruments and other type of ways of collecting data. It was developed by the scientific community through a consensus-based process, and it is a web-based resource or a website that is publicly available. Anyone can use it. What PhenX is it's not a new set of standards. It's not a new ontology of phenotypes and exposures. It does not provide any sort of data or biospecimens. It is not restrictive. Obviously, investigators can feel free to use other protocols that they so wish to use, and is not proprietary, so there is no cost to use the toolkit. So the first component of the COVID-19 project really began with the COVID-19 protocol library. The goal of this protocol library, it was launched in collaboration with the NIH DR2, and it was to provide a listing of all the available COVID-19 measurement protocols that were submitted to NIH. So that way people could have easy access to view them, download them, and ideally use these existing protocols versus developing new protocols, because as we know, during COVID-19, there's a lot going on in trying to understand the pandemic, not only the disease itself, but its impact on society. So this is what the library provides. And I also want to point out that, for example, we do have filters, and we also have a search option where you can search by keyword for protocols that would fall based on your search. Due to the development of the COVID-19 protocol library, this informed and led to the development of a COVID-19 research collection, because there were a lot of protocols in the library. But we want to provide a more concise collection that was focused on key topic areas that people were focused on from the pandemic. And so we end up basing the research collection from library instruments. We crowdsourced to define the categories. We then had our PhenX steering committee review the categories. We then conducted another round of crowdsourcing to identify protocols for each of the prioritized collections or the different categories that were identified. And then the steering committee reviewed the protocols that we identified, and we finalized the collection. So here I'm just showing you the collection landing page. As you can see, there were 6 collections that were formed: behavior and risk, ethnicity, race, and demographics, history, treatment, outcomes, information resources, psychosocial and mental health, and socioeconomic. And it also recommended that researchers who are interested in using these collections for COVID-19 related research also consider using the social determinants of health core research collection. So just a quick overview, very brief. If you were to go to any of those collections, you would encounter a page similar to this. You'd see the list of available protocols that are part of that. And you can see that these protocols in this case are all related to the higher level category of behaviors and risks. And this is just an example of what you were to view if you were to click on a single protocol. In this case, this is for COVID-19 knowledge, attitudes, and avoidant behaviors. And the information about the protocol is spread across the different tabs. And this includes, description, the actual protocol itself, how to administer the protocol, additional details, resources, references, and so on. Finally, I would like to present the COVID-19 variable compare tool. Now, there are 3 functions: the keyword search, side-by-side comparison, and the compare questionnaires. And I'm just going to really quickly go over them just because it will be hard a little bit to see the text because I'm trying to show the whole web page. But I do encourage you to, when you have a chance, to explore the tool yourself. So the keyword search, it's fairly straightforward. You type in a keyword and it provides variables at the question level of ones that match your search. We then have a side-by-side comparison. Again, fairly straightforward. You can pick 2 protocols and compare them side by side and see how much overlap there are between the protocols. And it's also broken down, for example, by identical, comparable, and related variables. So by identical meaning that they're exactly the same, what is your age, what is your age, same thing. Comparable, what is your age versus when you were born. If you manipulate that a bit, you can get the same answer. And related are questions that fall under a similar topic, but you really can't compare them, and they're not really getting the same exact data. And then finally, we have the compare questionnaires, which provides a heat map view of the similarity across all the protocols. You can either view them all in a single heat map, or you can specifically pick which protocols you want to compare, and it can be anywhere from only 2 up to all of them. So I'd like to just acknowledge the different groups that contributed to the project. We have the project scientists from NHGRI. We have our steering committee. There has been 29 research domains, so 29 working groups and groups of members that have contributed to PhenX over the years, the IC liaisons, as well as additional supplements and specialty collections that have provided funding for PhenX. And I also want to acknowledge our RTI team, Carol Hamilton, who is the PI, Tabitha Hendershot, and Wayne Huggins, who are co-Is, and obviously myself, I was part for the COVID-19 project. And feel free to check out the PhenX Toolkit website. It could be found at the URL listed here on the screen.
Thank you, Michelle. That's incredibly interesting. I'm already thinking of ways that we can share this information with our COVID students. I was even just thinking about our student paper challenge. I know Florence is nodding, which means that we're on the same wavelength, which is great. So for the audience, I just want to share that obviously each of our speakers' presentations today will be made available on our website, through our YouTube channel later this week. And before we get to the Q&A session, I already have quite a list running here. I'm going to quickly share my screen one last time to let our audience know about these two items related to what I was just saying about sharing this content on our website. With the help of our staff, students, and volunteers, we've assembled at the KIC two really great initiatives, one related to accessibility and one about our Spanish language resources. Together, we have transcribed each of our monthly webinars, just like this one. So individuals with either accessibility needs can read or learn about this research in written English rather than listen to it. And we've also translated these texts into Spanish. So the aim of these two initiatives is to make this very rich content accessible to as many people and as many different formats as we can and increase the diversity of our community. So you can learn more about these initiatives on our website. And if you're interested in helping our team build out these features or others, please do reach out to us and I will drop information about these programs into the chat. And before we even head into the Q&A session of today's webinar, I also want to share this information with the audience. I would encourage you to take advantage of the numerous ways you can stay in touch with the KIC and the Hub. So check out our website, our newsletter, Twitter, Instagram, Slack, LinkedIn, we're everywhere. If you have questions or concerns, ideas about our events, you can always email us as well. And I will share this info in the chat as well. So peruse these at your own pace. We love hearing from you, our community, so please reach out and keep an eye out for communications from us about our upcoming webinar sessions, including a workshop that we're planning for the fall. So, you'll be hearing from us and we look forward to bringing you into our community. So to that end, I will mention as well that when we close out our Zoom webinar today, you'll get a little pop-up asking you to take a survey about our event. So please consider giving us your feedback. We're always trying to improve. So let us know what you think. And so I will stop sharing my screen. I'll open it up to the main audience. Florence and I will go ahead and manage the Q&A session. Several of you have already posted questions. Thank you for that. If you also would like to at any point unmute yourself and directly ask a question, please go ahead and do that. Otherwise, I'm going to hand it to Florence to help us kick off the Q&A conversation with some questions for our speakers.
Sounds great. So before I jump in, does anyone have a question that they would like to ask? Okay, well, we'll get the ball rolling. So actually, I'd like to start with Michelle, like Lauren was saying. I looked through the COVID info comments while you were talking. I don't think we have your COVID-19 protocol library listed on there. So I feel like we should. I know, so I feel guilty already. But maybe you could take a peek at it and either look under the data sets or look under groups and guides. Let us know where you think it belongs. I could go in either maybe. So maybe you could look to see what the neighborhood looks like, and where you would like us to add it, and we can add a link to it. Okay.
Okay.
That sounds wonderful. Thank you. I was like, I can't believe we don't have this. On that note, would the PhenX Toolkit potentially expand to include recommendations of protocols for future pandemics? Not that we want to talk about that, but now we have monkeypox. Then, as I say, then it'll be giraffe pox. God knows what's going to happen next. So, do you see it expanding to future pandemics?
I think it will definitely depend on the needs at that time. Our funding, over the years has been based on recommendations by our working groups, kind of been what we get in terms of funding, whether it's from NHGRI or NHLBI. Currently I'm also a part of a social determinants of health expansion working group, because obviously that was a critical component, especially with the pandemic going on. So, I don't want to speak necessarily for my PI, but I think it will depend on the needs at that time and how critical it is.
Yeah, that makes sense. One of the things that we looked at, looking at the, the disaster response side, we've been thinking about what we were thinking of regarding natural hazards and cascading disasters during a pandemic. How things get even more complicated and interesting. I think way back when to Katrina, where they just threw everybody in the Superdome. Like that's not a good social distancing practice, right? So, we've been thinking about things like that. So do your protocols relate to that? Because you mentioned DR2, which I think is the disaster response side, right, from NIH?
Right. And we specifically worked with them to help share COVID-19 related protocols. So we don't have, within the library, we don't have any other protocols that they may have in the entire DR2 library. This was just a separate project that was focused on COVID-19.
Okay, and did you look at it in the context of a natural hazard or disaster, like during a flood or during a hurricane or during an evacuation, during wildfires, if anything is different or not yet?
No, we did not. We just worked with them to get any COVID-19, whether it had to do with disasters or whether it was strictly at the symptom level or the mental health level, the social interactions level, anything, as long as it was COVID-19 related, then that's what we included in our library.
That's very cool. Well, thank you very much.
Mm-hmm.
Now I'd like to go to a question to Joshua. Josh, do we know anything about how multilingual households engaged kids during the pandemic? Is it the amount of language exposure that encourages children's development, or is it diversity in exposure as well? Are there any interesting implications from that perspective?
There's lots of implications, and I think like the short answer is we don't know, right? So what we had hoped to be able to study, which we weren't able to do in real time, was actually how the diversity of number of speakers a child is hearing affected language acquisition. Because it's certainly one of the hardest things for artificial intelligence in terms of language understanding is dealing with the fact that people's voices are different. So this sort of like stimulus invariance is actually like computationally a really hard problem. And it's something that a lot of, kids who are little going into the pandemic, essentially, a lot of them were only hearing one or two speakers at all, right? So didn't even have to try to learn how to deal with different voices. But we don't know what happened, right? So I think this is something retrospectively we may be able to get at as we're looking at like school assessments and whatnot coming out of the pandemic. But we weren't able to record a lot of stuff during the pandemic for the obvious reason that, parents are pretty overwhelmed, including the parents who were trying to run our project.
I know. I don't know if they got an incentive, but kudos to them. They were part of it.
When I was listening sorry.
Oh, I was just going to say, I do get asked about bilingualism a bunch. Anecdotally, a lot of people reported that kids were doing better with minority languages during the pandemic. That was certainly true in our household. So Mandarin definitely became my daughter's primary language. Now, like many, bilinguals, she refuses to speak Mandarin at all because that's not what her friends speak. But since she had no friends during the pandemic, peer pressure was not an issue.
Oh, interesting. And Kaylin, I think you had something you wanted to share or ask.
Yeah, I think also in many, because my parents are Korean, it's kind of like, in a way, like a generational gap, because it's kind of hard to talk to them because my mom, for example, she's Korean and I don't really know Korean as much. But now that I'm staying at home, I've been able to like learn a lot more from that. So actually I do know a lot of students like myself. We're kind of trying to understand how to, balance in a way college with talking to parents. So I did agree with one thing that you said was one of your hypotheses was cultural problems with cultural solutions. So I think from how my parents grew up and then versus how I grew up, we don't really talk about certain things such as what's happening in the household or what exactly is going on. But for me, I chose to stay back home because I wanted to help my parents. So I think there's a lot of things to take into consideration too.
That's a very good point. My daughter was our shopping angel. They actually had a like a community service effort near us called Shopping Angels, and she was a shopping angel for another family too, which was kind of cool. It's very sweet that you wanted to do that. Very interesting. Another question, Josh, and then we'll go over to Michael and Alysha. In some other presentations, we've heard KIC speakers talk about the parenting role of siblings as alternate caregivers, or sometimes primary, depending on what's going on in the home during the pandemic. Do you think that sibling engagement in childcare would have an effect on children's development, or is parental engagement most important? Or it could even be, I mean, you had grandma in the loop, right? Or it could even be a babysitter, or the kid next door who's older that you used to babysit for, there's like a ladder of babysitting. So are there any comments on that?
Yeah, well, as I said, that was actually babysitters and neighborhoods were part of the resources that were lost, particularly in the early part of the pandemic, right? I mean, it's certainly true that so one of the things that they guys talked about a lot in child development is that historically and in many cultures still, most childcare is not performed by the parents of the child, right? So siblings and older children in the neighborhood actually provide most of the childcare. And this is actually, I think, very relevant for thinking about what was going on during the pandemic in terms of loss of childcare. It would, 70 years ago, when kids were mostly essentially feral, it would not have been as big of an issue, right? So part of the issue was that, a large portion of the society right now is not comfortable with children being alone and unsupervised by parents or adults. So if the adults are not available and they can't go to school, then TV is the only other option. But that is certainly not the only way that societies organize themselves.
Yeah, and there was so much more socialization. I know I have a lot of friends that still talk about they made you go outside and then you had to come home when the street lights went on. That's how we used to manage in our neighborhood. I don't know if any of the rest of you did that too. Right?
That's how I grew up.
Yeah, right. It was actually fun, right? And then the fireflies would come out and you could catch them, which was a lot of fun too. I still like looking at them. Very interesting. So now, Michael and Alysha, how does your study account for international students' residential choices during the pandemic? Was the student sample primarily U.S. students or a mix? And would you expect any difference in the perceptions and attitudes of international students?
Well, our sample did include international students. It was a very small percentage. The majority of our students stayed within the state within their university. So we actually asked them where they were residing, in which state. And I believe we only had a few students that ended up leaving the state to go back to live with their family. So it's possible that the international students either remained within, primarily the international students within this population were from Asian countries. So it's possible they were not able to travel back to their home countries. But I think that definitely would fit into those students that had to stay within their state residences.
That makes sense. And would you expect similar results for findings from other student groups, such as high school or middle school students? Is there anything unique about college or graduate students, beside the fact that they're too young to go out on their own legally?
Yeah, well, that you kind of touch on it there. There's a differential expectation of autonomy when we're talking about high school students versus college students. A majority of the students who were living at home in that second wave of data collection weren't living at home prior to that data collection. So in high school, most students live at home, and that's their expectation. In college, we're talking about students who were living elsewhere, have made the choice to live elsewhere, primarily with a romantic partner or roommates. And due to COVID or due to other circumstances, had to change their domicile to living with parents. And it's that transition that breaking of expectation or that shifting of expectation that you wouldn't find in high school students. And while in younger people in high school and middle school, autonomy is found primarily through who you choose to be friends with and what you choose to do when you're alone in those moments that you are alone. In college, the expectation of autonomy is almost complete. If you left the home, you have become an autonomous being. And now, because of circumstances beyond your control, that has been curtailed. We suspect, and we talked about that a little bit on what we want to do going forward, that curtailing of autonomy might have impacts on things like your level of depression and day-to-day well-being, the size of your friend group and the closeness that you have with your friend group. You could imagine a situation where if you're forced to live at home, your friend group shrinks, but those friends that you do have contact with are that much stronger because they're giving you an outlet outside of the home. Now, I'm speaking about living at home with kind of a negative hue, but it's important to mention that a lot of students enjoyed living at home, enjoyed the opportunity to save money and to become closer with their family. But I think the primary point you were getting at is that it wasn't necessarily their choice. These are people who had made the decision to live elsewhere at first. So that breaking of expectation would differ based on the age group of the students.
That's fair. And you don't have to cook either. And you don't have to take
Right, right, is that there? Yeah. Laundry becomes easier.
Yeah, it's a washer and dryer in the house that you throw your stuff in with your parents. It's, you have it made, but then they're like, I have to get out of here, right?
Right. Yeah.
Totally
Absolutely.
understand. Very interesting. The other question you had, Michael and Alysha, for your research, and we talked a little bit about this in the prep session, and you referred to it, is the causality or correlation with what was going on in society, right? You call them comorbidities, I think, or the co-situations. I don't know the right term. So I think that's very hard to tease out of the data because it is so contextual. But do you have any comments on that, of how you would look at causality versus correlation versus something else?
Yeah, we're very interested in that. As identity researchers, primarily, the thought of what factors in kind of this macro sphere of influence coming at you are the most impactful is incredibly important. And when you've got this large, overwhelming cohort effect of COVID, it almost feels inevitable that that's going to co-vary with other things that are going on. But for example, I mentioned kind of these intense and frequent instances of racialized violence that were happening all over the country. We did find connections between, for example, students reporting spending time with peers of other ethnic racial groups. It dipped starkly when the pandemic started, as expected, because your friend group kind of shrinks, you're going home, you don't have a lot of access to other people. And oftentimes the people that we stop talking to the first are the people who we aren't as close with. And research suggests that diverse friends can be harder to become tight-knit with at an earlier age. But after George Floyd's murder, for example, that instance of contact with diverse peers went up. And we suspect that's that incident of, after these intense racialized incidents, people seeking out friends and support and information from peers and friends from other ethnic racial groups. We don't think that has to do with COVID because the kind of the COVID variable at that point was pretty static. We were in lockdown, but these other cultural events were spiking in the news. And we found connections. Again, they're just correlations, but we found connections between those spikes in the news, these incidents, and the decisions that people made about who they choose to spend time with. That's the kind of data we want to parse out a little bit more. And in the ethnic identity research, it does follow that when racialized events happen, race tends to be more pertinent in our lives. So we can make suppositions and well-informed guesses, but with COVID so constant, it's hard to parse that out, as you suggested.
Yes, very interesting. As I listened to all of you, actually, and I'll just share, when we were doing the COVID Info Commons extension proposal, and they said, think about, how you're going to enable recovery. I'm like, recovery is a very different thought than it was when we started. people were like, okay, so we'll get the show on the road and we'll be back, but then bing, and the schools will open, the economy will open, and all these businesses will start. It's like so fast, right? And now as COVID continues and new poxes come in place, monkeypox, as I said, giraffe pox, it's not a real thing. I just made that up to make the point that, new things are coming out. Zoonotic diseases are a thing that we're talking about a lot. That'll probably be a topic of the KIC annual workshop that we're going to do later this year. I just think it's a very interesting topic and we should kind of keep our eyes on that. But as we think about it going forward, there's new opportunity to do new research because we're living in this now. It's not like recovery is over. Okay, that's done, right? And there are so many long-term implications of it. So we encourage all of you to think about how you can find other researchers through a webinar like this or using the KIC portal. And, let's come up with ideas on what other types of research should be funded, how we can leverage this for society, and thinking about the other contextual challenges that are going to come into place, like additional pandemics or the confluence of pandemics with natural hazards and disasters. What a happy thing. I have to smile when I say this because it's kind of sad. But, I think there's an opportunity to think about this some more. And we've been looking forward to seeing if they were going to announce the NSF PIP Awards. I don't know if any of you responded to that. It was the Predictive Intelligence for Pandemic Prevention. It's like Peter Piper picked a peppers. And so that was a solicitation from last year, and we haven't seen any of the awards come out yet, but that might be interesting too to look at. So we would encourage you to continue the collaboration. We really appreciate that you joined us today. And use the KIC tools. Let us know if we can help you. And are there any other questions or comments that anybody would like to make while we're together? No, getting out early on a Friday. Boy, what a great webinar, huh? So, well, you've all been wonderful. Thank you. And Kaylin, thank you so much for your help in joining us and participating in the discussion. You're part of the future leaders of our planet. So we're really glad that you're here. And Lauren, anything else before we sign off?
No, I think you covered it. Thank you, everyone, for your great presentations. It's always a rich and interesting discussion. So we've done it again this month, and we'll be announcing some additional webinars for the fall the fall season shortly.
Great. Okay, thank you, everybody.